Hello everyone. In this class, we'll study about the venous system. The learning objectives are to understand the difference in pressure-volume relation between arteries and veins, learn the importance of venous circulation in determining cardiac output, give the normal values of central venous pressure and peripheral venous pressure at different levels of standing position, appreciate the clinical importance of venous pressure, especially during neurosurgical procedures. Components of venous system. The venous system consists of capillaries, venules, small veins, large veins, and vena cava. The veins contain all the three layers of the blood vessels, but they are significantly thinner due to the thin muscle coat. Their important functions are: venous system transports deoxygenated blood from the tissues to the heart. Veins act as a capacitant vessels as they can accommodate a large volume of blood. They act as a reservoir of blood. In fact, more than 60% of the total blood is present in the venous compartment. Pressure-volume relationship of veins. The veins are thin-walled and have less quantity of smooth muscle. Therefore, they are easily distensible and collapsible. The increase in the volume of blood in veins does not affect significant change in the pressure up to a point beyond which the pressure rises steeply. Normally, veins are partially collapsed. Thus, they easily accommodate a large amount of blood without any change in the pressure till they are fully distended. However, once the lumen of the vein becomes spherical, the pressure rises steeply, whereas in arteries, the pressure-volume relationship is almost linear. Here you can see the pressure changes in the artery. It's almost like linear, whereas in the veins, the pressure is going to raise much until it reaches the critical point, and then it raises abruptly. Veins are innervated by the sympathetic fibers. The density of innervation is less in comparison to arteries. However, veins are more sensitive to sympathetic discharge than arteries due to the greater nerve fiber to muscle fiber ratio. Therefore, a significant venoconstriction occurs even at mild sympathetic stimulation that increases venous return adequately. Venous return. The amount of blood that drains into the right atrium from the venous compartment is called as venous return. It is one of the major determinants of cardiac output. Change in the venous return changes cardiac output by changing the end diastolic volume, that is preload, of the ventricle by Frank-Starling's mechanism. Venous return is influenced by total blood volume, sympathetic stimulation, venous tone, skeletal muscle pumping, thoracic pumping, and abdominal pumping. Veins are provided with the valves that allow forward flow of blood. The valves are well developed, especially in the limb veins. When skeletal muscles contract, the blood is squeezed in veins towards the heart that increase the venous return and cardiac output. The backflow of the blood is prevented by the venous walls. Venous pressures. Central venous pressure. The pressure in the great veins at the entrance into the right atrium is called as central venous pressure, that is CVP. CVP is normally about 0 to 5 mm of Hg, but it can be minus 5 mm of G when the rate and force of contraction of the heart increases. The CVP is measured directly by inserting a catheter into the great veins in the thorax. The right atrial pressure is also measured to determine the CVP. Jugular venous pressure reflects the right atrial activity. Peripheral venous pressure. Pressure in the venules is about 15 mm of Hg. Venous pressure increases as the blood flow to the larger veins. The pressure in the great veins outside the thorax is about 5.5 mm of Hg. Effect of gravity on venous pressure. On standing posture, venous pressure decreases by 0.77 mm of Hg for each centimeter above the heart. Thus, venous pressure is minus 10 mm of Hg in the superior sagittal sinus. The venous pressure increases by 0.77 mm Hg per cm below the right atrium, so that it is as high as plus 85 mmHg at feet. This shows a different uh, pressure at the different height. So at right atrial level, if it is zero, at the head level it is about minus 10 mmHg, and at the thigh level it is around 40, and at the feet it is around 85 mm of Hg. In upright position, venous pressure above the heart level decreases due to the effect of gravity, so that the venous pressure in the neck and head is negative. These veins therefore are normally collapsed. The pressure in collapsed vein is zero rather than subatmospheric. However, the pressure in the dural sinuses in upright or sitting posture is subatmospheric, as the sinuses do not collapse due to their rigid walls. This is in brief about the venous system. Thank you.